My colleagues, members of the press, Assalamu alaikum. I wish to express my delight in addressing you today at the flag-off of the 2021 Annual Physicians Week of the Nigerian Medical Association. This annual week-long event is being marked at both the national level and in all the state branches of Nigerian Medical Association and the Federal Capital Territory. The week is used to celebrate ourselves as doctors who are contributing to effective health service delivery and health research and Nigeria's national development. We also use this period to reflect and review events of the health sector in the first 12 months on our achievements and challenges so far, that we can design the way forward to improve the health of our people. The activities lined up for the week include prayers in mosques and churches, advocacy to critical stakeholders in all 36 states, including the FCT, brainstorming on challenges affecting the health sector and proper solutions, media engagement to create more awareness on the importance of health system strengthening and management, continuous medical education, medical outreaches, mentoring session for our young colleagues in the profession, for our mentoring for our own colleagues in the profession, celebrating ourselves for honoring our colleagues who have made significant positive contributions to our profession and the health sector as a whole. The lingering health crisis and challenges, the year 2021 will live in our memories for a long time, as it will be remembering the challenges that have confronted the health sector, as well as the national economic challenges, occasioned specifically the continuing COVID-19 pandemic. The period has been characterized by issues of welfare of medical and dental practitioners, which culminated in industrial action by Nigerian Association of Resident Doctors, NARD. Fortunately, after the sustained advocacy and constructive engagement by the leadership of our association to the government and dialogue among members of the profession, including convoking an emergency delegate meeting, the strike has been suspended by NARD through democratic decision. No doubt that Nigerians had a sufficient dose of the unpleasant effects of the strike action by NARD, which we wished could have been avoided through proactive intervention of the government. We wish to appeal to the various agencies of government to ensure that urgent attention and appropriate response be given to the full and complete implementation of the Memorandum of Understanding signed by the Nigerian Medical Association. The COVID-19 pandemic challenges on healthcare. The health sector has suffered monumental losses following this period of COVID-19 pandemic. In commemorating this year's Physicians Week, it is important that we reflect on the devastating effect of coronavirus disease on all social and economic circumstances, including health, education, economy, and entire social life globally. We must use today's event to remember our members who paid supreme price on line of duty in saving the lives of Nigerians who were infected with the disease. May their soul be granted eternal rest. Amen. I urge all of us to continue to follow the established protocols while calling on the government to continue to provide the necessary safety kits for health workers, as well as conducive working environment for healthcare workers. The theme of this year's event is Nigeria in the COVID era, health system strengthening for national security and prosperity. This year's theme was carefully chosen to be in tandem with the prevailing devastating COVID-19 pandemic, characterized by the first and second waves and emerging variants. The healthcare investment and financing. It's evident to note that the COVID-19 pandemic has greatly exposed the nation's poor health sector with observable dilapidating health facilities and poor remuneration of healthcare workers. This has resulted in the call for a total overhaul of the nation's health sector, with the need to improve on financing the healthcare sector in terms of budgetary allocation, effective implementation of National Health Insurance Scheme, while enacting a law that will make the scheme compulsory for all adult Nigerians, as well as exploring alternative healthcare financing initiative like the proposed Health Bank by the Nigerian Medical Association. It is also pertinent to track the release and use of funds released for healthcare services at the federal, state, and local government level. Government should intensify its efforts in the public-private policy initiative, that is the PPP. For doctor safety and hazard allowances, we wish to again reiterate issues of doctors and indeed health workers' welfare, including the commensurate payment of hazard allowance, be implemented without further delay. Doing so will definitely renew confidence, commitment, and dedication of health workers to delivery of quality health to Nigerian people. The issue of brain drain among medical doctors must be urgently addressed by government, otherwise the consequences of turning a blind eye to this will be ominous. Earlier than expected. While attempts to reversing the trend may be Herculean task, with Nigeria being worse off. Incentivization of health care workers will motivate them to work harder and give their best, as health, it is said, is wealth. But we add that health is better than wealth.